So hi everyone, thank you for joining us for this session. Before we get started, just a reminder about the Q&As. It should be on your right-hand side, either on the top or the bottom. So if you have any questions for the panelists or regarding the session, please use the Q&A for the questions, so that way all the panelists can see the questions coming in. Some people that are using the chat, sometimes the chat just comes to me and the panelists can't see the questions. So just a reminder just to use the Q&A, so that way everybody can see the question. Reminder too that the session will be recorded. It will be made available later at a later date for viewing. So if you missed the beginning part, you can go back and watch the session again. So I'm going to introduce Stephanie Kendrick, who is with the Hawaiian Humane Society. She will be introducing the session topic for today and also introducing the panelists who will be speaking today. Okay. Thanks, Stephanie.
Thanks, Danny. Hi, everybody. I'm Stephanie Kendrick. I'm the public policy advocate for the Hawaiian Humane Society. Our panel topic today is barriers to housing for homeless pet owners and strategies for meeting that need. Thanks to our collaboration with Partners in Care, we have a pretty good idea of the magnitude of the need. In 2019, we added a question to the point in time count for the first time regarding pet ownership among unsheltered homeless people on Oahu, that is, and we found that at that time that about 25% of those surveyed reported owning at least one pet. This year, the 2020 count, it was 29% of unsheltered respondents reported owning a pet. So we know that there's a lot of need out there for the folks that you are most trying to help. And this is about a conversation about how do we get more access to emergency, transitional, and permanent housing for homeless folks who have pets, and what needs to happen to make that happen. I've been Hawaiian Humane's liaison to Partners in Care for the last 3 years and have really valued that collaboration and learning more about the amazing work that you all do. And Hawaiian Humane is just really grateful that homeless service providers understand the importance of the human-animal bond, especially among folks who are going through crisis. So with everything that you have to think about in your work life, I'm grateful that you have take time to think about this issue and to respond to the concerns of people who have pets in their lives and value them. So we're going to do, each of our panelists is going to talk for 10 minutes about their perspective on this issue. And then we've saved the full 30 minutes for Q&A at the end. So please, as Danny was saying, put your questions into that Q&A box, and I'll be monitoring that and fielding those out to our panelists. So our first panel presentation is going to be by Dr. Aleisha Swartz. Dr. Aleisha is a veterinarian, educator, researcher, and shelter medicine specialist, She's followed that passion for shelter medicine into work with large nonprofit and municipal shelters, as well as spay-neuter programs and smaller rescue groups. In addition to being the head of the Honolulu chapter of the Street Dog Coalition, which does wellness checks and veterinary clinics at Punawai Rest Stop, Dr. Aleisha is chief of service at the University of Madison, Wisconsin's veterinary program and is past president of the Hawaii Veterinary Medical Association. Dr. Aleisha, take it away.
Thank you so much, Steph, and aloha to everyone. And I appreciate the opportunity to come and share a little bit about my experience as a veterinarian and working in this community. I began my career as a private practice veterinarian, but I've spent the last 10 years in shelter medicine. And what we realized in shelter medicine is that we oftentimes are crossing paths with pets that are vulnerable for a variety of reasons and people that are vulnerable for a variety of reasons. And as veterinarians, we are trained in what's called a One Health approach. And that's the concept that the health of animals and humans and the environment is all interconnected. And it's important to be aware that they are linked to one another. And so the health of animals can impact the health of humans, and the same as the environment. And probably no greater example to highlight that other than the current pandemic, which is started from a zoonotic disease and animal origin disease. And so I just say that because I think oftentimes people think, well, why does it matter if the pets get care? But we do know that that's related. And we also know that the health of the pets is related to the health of the humans. And then we also know that the importance of the human-animal bond, as Steph mentioned, it is very important. Anybody who's ever bonded with any animal, whether that's caring for an injured animal or having your own pets at home or feeding an animal in need, knows that bond has significant benefits, not only to the animal, but to ourselves. And our well-being is significantly improved by that bond with the animals. And so after being in shelter medicine, now my work is with shelters all over the country. But as I looked to continue to make an impact in this community, I became a volunteer for an organization called the Street Dog Coalition. And the Street Dog Coalition is a Colorado-based nonprofit run by a veterinarian. And he partners with licensed veterinarians in a variety of different states and communities, and they provide the medical supplies, and we provide our time and services. So we're all volunteer, veterinarians and technicians providing care to people who are at risk of or experiencing homelessness. And so we began working as soon as Punavai Rest Stop opened. We began offering veterinary services. And unfortunately, we've been on hiatus since this pandemic began, but are looking at ways of restarting that. And what our goal is to provide care for preventive care as much as possible. So as much as we can prevent conditions and illnesses, infectious disease, things like vaccinations, things like deworming, conditions that can affect human and animals, and maintain their well-being. And then we also provide palliative and comfort care. So painful conditions, conditions that we can treat basically with whatever I can pack in my vehicle and take down to Punavai that day. And thanks to the generosity of Hawaiian Humane Society, we've also been able to offer spay-neuter services to clients who are interested and willing to participate in that at no cost. All of our care is at no cost. And then we've also partnered with a few local veterinarians to provide more advanced care that we cannot provide there on site. And so that is what our objective is. When I think about pets going into housing, so what are the concerns, especially from the medical aspect? What are the concerns of pets going into housing? Our first goal is always to keep the pets and the people together. While at first it might make sense to have a segregated kennel where pets are housed, behaviorally, health-wise, all the things will be better if we can keep the pets and the people together. And there's a few key things that we think about when we think about maintaining health and ways to do that safely. We're very lucky in Hawaii, we don't have rabies. And so on the continent, they have to worry about rabies vaccinations and laws and certificates and things like that, but we don't have to worry about that here. So I think my lucky stars for that very often. Other things that are of concern are parasites. Probably one of the most common things that we see are things like fleas, ticks in dogs, or intestinal parasites. These are all things that can be readily treated, and there's oftentimes over-the-counter products that we can use to treat these. And so pretty simple, easy interventions can be implemented on either intake to a shelter or prior to that, where animals can come in without being a risk for bringing fleas and ticks in. This is something that we can readily treat. There are vaccinations for common infectious diseases in animals, but we also have other ways to mitigate that through things like we want to always make sure we have the ability to remove feces from environment and give people support and the resources needed to do things to maintain animal well-being. I would say one thing from my experience in working with pet owners at the Punavai Rest Stop is the almost every animal we've interacted with has had a great overall level of health. Like, people want care for their pets. They just haven't had access to it. And so giving people access to care, they're seeking more preventive care. As we build relationships with people, they're more willing to allow them to be spayed or neutered, to reduce the number of animals. They're eager and active and interested in seeking care, and it's pretty typical. We have previously done walk-in, first come, first served, and we have a big line when we get there. And we've been able to see everybody who shows up, but I think people may wait 2 hours to be seen. So people really would like this care. They just haven't had access to it. But kind of circling back to the human-animal bond part, I think the thing that has been the most telling to me in working with this community is the level of attachment. Pets provide us such unconditional love and support that may be challenging for people to get and as readily and easily in all areas of our life. And people are so extremely bonded to their pet, and they're terrified that they will not get them back if they take them for spay neuter. There's a significant amount of concern about not having access to their pet and the stability and comfort that that gives them. And I see a deep bond between people and their pets. And I feel like as a community, we should do what we can to support that bond. And as a veterinarian, I'll do what I can to help encourage and keep that bond and support service providers who are looking for ways to do that in a way that works for you and your organization. And I will send it back to Steph. I think Gracie might be next.
Thanks, Dr. Aleisha. So Gracie Suaglar is our next presenter. She's the Landlord Engagement Program and Manager for Partners in Care. You guys probably are pretty familiar with her work. She just had a great discussion herself at the conference. Gracie graduated with a bachelor's degree in social work and interned at IHS, where she discovered a passion working with clients experiencing homelessness. Gracie's work has shown her that housing is the key to support our most vulnerable community members, and she's passionate about getting folks housed. Gracie, take it away.
Good morning. So as I stated, I love working with our most vulnerable community members, but also a lot of people forget about their extended family members, which is their pets. And I've noticed over the past years, since I've been housing clientele that we serve, that clients that do have pets have a harder time getting into housing. And I think one of the reasons why is that people forget that pets are an extension of the human, and they don't see it as being as part of a family member. With LEP, we have housed at least 63 clients that have pets. What we're running into is that we now have clientele with not just one, they have 2 to 3 extended family members. So those are our challenges in housing. What LEP is doing is we're offering landlords incentives to house our clientele with 1 to 3 pets. Meaning with incentives, we remind them that we have a risk mitigation fund that can cover damages that are created during their housing stay. But also we inform the landlords that our clients that do have pets have their animals are linked to some type of vet service. Either it's with Canine or Hawaiian Humane Society or the Punabai Rest Stop. We let them know that the animals have clean bill of health, that the clients will then pick up after their animals, and things like that. So we try really hard to engage a lot of landlords to accept pets. We recently engaged a client in the Kapahulu area that has 9 small pets. We have not asked her, I think one of the reasons why she hasn't chosen housing before was because she was told that she would have to separate from some of the pets, and she doesn't want to. And so LEP is trying to engage a landlord on the west side to house the client and her 9 pets. So right now, what we're trying to do is find a home that is large enough to accommodate those 9 pets, and then offer the landlord the incentives of risk mitigation fund, things like that, and also remind the landlord that, hey, we will go over with the owner about cleaning up after the pets, making sure that we can show proof of a clean bill of health for the animals, because that's some of the things that a lot of the landlords ask for. Another thing that has been coming up recently is a lot of landlords are asking for pet insurance, which can be a little bit of a challenging for some of the clients that we serve. So that's something that LEP is looking to right now, to see if there's ways that providers may be able to assist the clientele in obtaining those type of insurances for the animals. But it is a challenge housing our clientele with that have numerous amount of pets. We do not ask them to separate from their pets. We really want to keep them all together. And we really think that it's very important. And we want to make sure that providers who are working with these clientele remember that it is an extension of the human, and not to forget about that. But basically that's it. If you need assistance with any of your clientele for housing that has pets, please call LEP. We'll be more than happy to assist with that. You can either call me on my cell phone, or you can go onto our Partners in Care website and put in an agency request form. Majority of the landlords that we do work with are all pet lovers, so that's really great. We want to make sure that we partner our clientele with the appropriate landlord, and that way there be support both ways. If you hear of anybody that has a 1 acre farmland that wants to house 9 pets, let me know as well. But other than that, LEP is trying to obtain an easier way for our clientele with numerous pets to get into housing, and get into housing really quick, and then linking them up to current pet services so that they can be in compliance with their housing, and not have any issues or concerns that will prevent them from being housed. Other than that, it's a pleasure.
Gracie, thanks so much for all the great work you're doing. Just want to encourage the participants again, you can enter questions into the Q&A anytime. I'll be monitoring that. You don't have to wait until the end. Our next panelist is Suzy Tam. She arrived at the Hawaiian Humane Society with an extensive background in marketing and communications, and she led those efforts for the organization, doing publicity and producing events for us. Suzy, though, quickly came to realize that her passion was not just for helping animals, but for helping people in need as well. And she is now manager of our Community Outreach and Partnerships program. So she leads Hawaiian Humane's outreach and education team. She works with students, community members island-wide, and really Suzy's program is very much starting to increase its focus on pet owners in need, be they housed or unhoused, and we're excited to see where that program's going. Suzy.
Hi, everyone. Thanks for having me today. I'm really excited to be here. So many of you know the Hawaiian Humane Society. We've been around for over 100 years, and the thing that we're most known for is adopting out animals as well as admitting them into our shelter. But you know, with many changes in leadership, we've come to quickly realize that there needs to be a way to stem the flow of animals coming into the shelter in the first place. And part of that is helping pet owners in need. You know, if we can provide the resources or try to help to point them out to resources to stop them from even needing to surrender their animals, all the better all around. The more work we can do to help animals, the more work we can help to do the community. So we've always done some sort of outreach for as long as I've been there, much longer than I've been there, particularly with our field services team, who are our humane investigators investigating cruelty, neglect, and all of that. Their first approach is always education, but their team couldn't do it alone. So in the last year, we decided to make changes to our outreach program. We've always had a pet food bank. We've had the pet food bank since 2010, but pet food is just one of the many resources that we find homeless pet owners, as well as those who are on assistance, those who are unemployed need. And we worked to expand, and we now call it the Pet Kokua program. The Pet Kokua program is our education and outreach arm of the Hawaiian Humane Society. Education-wise, we go out to schools to start teaching our youth about compassion and empathy, and teach them how to be a responsible pet owner, all the things that go in it. We also provide education to adult pet owners, to the community, on what to do with animals in their community. And we have a pet program. So if there is someone who was living on the streets, maybe they don't know the difference between how to be a good neighbor when they bring their animal to housing, we can provide that kind of training, just letting them know, what kind of things that are expected, that they should clean up, that they need a microchip, the importance of spay and neuter and things like that. But our outreach program has really taken off, and we've been building this for the last year, and hopefully next year we'll be really ready to take off. And that includes things like the pet food bank. Since COVID hit, we've gone from distributing 1,000 to 1,200 pounds a month of food a month to pet owners in need to 5,000 pounds. So pet food is something, it's just your basic sustenance that we're finding that is really needed, not just amongst our unsheltered homeless or sheltered homeless, but amongst those who are on government assistance or have found themselves unemployed during this pandemic. We also offer free leashes and collars for those who need it, because we find a lot of people coming in with ropes tied to those collars, and that's not necessarily the best thing. It's not the most sturdy. Animals can chew through those ropes, so we provide leashes. I've had people come in with belts attached to collars, so leashes and collars are something important. If we have cat litter, even just to help people get through buying a month's worth of litter, we'll provide whatever we can. So anything that's really not needed for shelter animals, we try to turn around and use at the pet food bank. And people have been using those resources to a great extent, especially in the last 7 months or so. Other things that we have done in the past and that we're hoping to pick up again next year are free microchipping events. For those of you who don't know, microchip is required now by law for all dogs over 3 months of age and cats over 4 months of age, I believe. So we are trying to find an easy way for people to get microchips, particularly for those who can't afford it. $10, $20 might be a bit much for someone, especially if they have to decide whether or not to buy themselves some food or their pet some food versus getting a microchip. So we're trying to find ways to help people do that, whether it's a reduced fee microchip or a free microchip. We're really pushing spay and neuter. The pet overpopulation problem out there is really great, and spay and neuter is not always the most affordable. As Dr. Aleisha mentioned, we've helped Street Dog Coalition with free spay and neuter, but we're also providing assistance through our pet food bank, whether it's pointing them to the City and County's Neuter Now program, where they can buy a certificate for $20, or even providing spay and neuter for those which $20 isn't affordable, or maybe they don't have identification or an EBT card. We're able to find a way to work with our community spay neuter center to provide access to something like that, so we don't see more puppies being born on the street, which happens quite a lot when you go out, especially to homeless kids. You'll see a lot of puppies born all year round. Some of the other things that we do is try to work with human services agencies. We worked with IHS, their Staten Island Hale Maliola, to provide pet food, leashes, and collars. And hopefully we can continue that partnership and even do more with pet owners living there. We've worked with the Next Step Shelter, which is just up the road from our campus, to help the pet owners there, whether it's referring them to veterinary care, providing them something simple as pet food, or just talking story to get to know them so they know they can come to us if they have any questions. But with all of these things that we're doing, the thing that I hear the most from a lot of the pet owners is that they just can't find a place to go with their pets, particularly the ones who are living their street. You know, a lot of them have large animals. They have pit bulls and Rottweilers, and there are many, many places here with restrictions on breeds. And, you know, that tends to be a little unfair because we're stigmatizing animals because of a breed that they have, that it's a stigma that they normally don't deserve. We see lots of very friendly pit bulls, lots of very friendly Rottweilers and Dobermans that can go into housing that are perfectly fine around people and other pets. And it's hard for people to find housing all across the board if they have one of those types of animals. There's a lot of weight restrictions out there, a lot of buildings that we see, you know, you have to have a pet under 25 pounds. I was lucky to find a building that allowed a dog of any weight, but a lot of buildings say no, you know, your pet has to be small. There's a lot of number restrictions, as Gracie mentioned. You know, you can only have 2 pets, and oftentimes we'll see people in these homeless communities who have, you know, upwards of 5 dogs. And our belief at the Hawaiian Humane Society in the end is to keep these families together. As Gracie mentioned, we don't want them to give up their pets unless it's some kind of unsafe situation that we're seeing. Of course, we don't want them to have more pets. We don't want their animals to continue breeding because that's not going to help anyone, but we don't want to separate them because what we see and what is abundantly clear every time we're working with anyone is the amount of love that they have for their animal. The bond that I see between these pet owners and their pet is so strong. You know, oftentimes they're with their pet owner, the pet owners are with their animals 24/7. That's a lot more than I could give my pet. You know, I go to work, I go out, you know, but these pets are with their families all the time. And for us to separate that, you know, it's something that we really don't want to see happen. I mean, you're breaking a bond that has been built so strongly. And with these pet owners, sometimes it's the only family that they have. It's the one thing that's keeping them going. It's the one thing that might be keeping their mental health stable as well. And there's really no joy in having to separate a unit like that. The other comment that I get is that their animals have changed their lives. You know, people have come to my pet food bank saying, you know, thank you, I don't need your pet food bank anymore, but my pet has caused me to want to find a different way of living, to find housing, to better myself, to get my job, just so I can take care of my animal even better. And I don't need your services anymore, but I just wanted to thank you. And to me, that's the ultimate end game that we want to see, is people to further everything to keep their family unit together and do better by their animals. So we're really working to expand our services to be a little more boots on the ground, to get to know some of the pet owners, particularly in West Oahu, which is really far from our shelter. And most of the people in West Oahu can't get to the Hawaiian Humane Society. The transportation is an issue. And to build those relationships so we can get them veterinary care if we need it, or at least refer them or work with groups like Street Dog Coalition to see if we can provide some kind of vet care, or point them to resources, or get them just even a bag of dog food so they can get by for the month and not have to choose between feeding themselves or their pets. So it's something that's we're really passionate about, trying to keep these families together and really prevent these animals from having the need to come into the Hawaiian Humane Society and finding new families, because there's really no need for that if we can provide something as simple as a leash and collar, or microchip, or pet food, or even wellness care. So that's kind of what I've got. And I guess I will turn it back over to staff.
Thanks, Susie. Let's get to some questions, everybody. We've got, the first one I see is from Emerald D. Balonso. I hope I pronounced your name correctly. I apologize if not. Do you have any resources for temporary housing, fostering of pets if the landlord does not prefer to have pets in the unit? I can answer that for Hawaiian Humane. Excuse me. We do have an emergency foster care program for folks who are experiencing kind of an unexpected crisis that would prevent them from holding on to their pet at that moment. Things like they have to go to the hospital, or in the case of homeless sweeps, often people are being disrupted and they don't know where they're going to land, or even folks who've been arrested and need temporary custody of their pets. We don't, though, have the capacity to house pets for sort of open-ended amount of time. So if it's just a situation of, my current landlord doesn't want me to have my pet in the unit, that the person would really have to have an end game in terms of how they're going to resolve that situation so they could take the animal back. Because housing animals for a long period of time in a shelter, one, isn't healthy for the animals, and two, does impact our capacity to care for the other animals who need us. So that's Hawaiian Humane's perspective on that. I don't know, Dr. Aleisha and Gracie, if you guys have any ideas about temporary housing for animals?
Have a temporary solution to housing animals, but I would definitely look at rehousing the family so that the pet and the owner could be reunified and stay together. Basically, that would be the ultimate goal, would be to rehouse them into a pet-friendly environment.
Yep. And I would just add, nationally, this is the trend. Like, this is where animal welfare organizations are moving toward, is providing these kind of services, especially knowing that given our current situation, that there are many people who are facing housing crisis. And so expanding these programs is a priority of animal welfare organizations, I think, all over right now. Safety net programming.
Are there any examples of state or county level policies, incentives that have been successful to motivate landlords, property managers to reconsider switching to make their properties pet-friendly units? That's a really great question.
So on the landlord engagement part, we offer landlords incentives, meaning, the risk mitigation fund. We remind them that, hey, we can provide pet training, pet advocacy, just as Susie had stated, just reminding pet owners that this is what needs to be practiced so that we can maintain good landlord relationships. But we do remind landlords, hey, if you accept our clientele that has 3 dogs, we would be able to support with this, and that, meaning the the damage, If anything is damaged after the client leaves, we'll be able to pay for that. We also remind the landlords too that our clientele does have supportive services in place, meaning case management, that comes by or talks stories with the clients and reminds them about the pet mannerism and etiquette. Hey, don't forget, make sure you clean up after your pet. Make sure your pet is microchipped, I also provide, when I used to do direct services, I used to make sure that I linked up the client to the Humane Society to do vet assessments. I would keep a copy in their file, and then I would also turn that in to the landlord, say, hey, pets has a clean bill of health, and things like that. So that really works. And again, it's just reminding the clients that, hey, don't forget, pick up after your pets and things like that. And then just reminding landlords, hey, we do have this fund just in case there is any damages. But also our clients do come with supportive services in place. So it's having the case managers remind the clientele about pet etiquette.
Thanks, Gracie.
Thanks,
Anyone
Steph.
else
There
have?
was a question before. No, I just saw there was a question before. I'm not sure if you can see it, but it was a very interesting question to me. And so I just wanted to make sure we covered that one. It's asking about how people who are experiencing homelessness acquire their pets, because I think that's a common misperception. And studies have been done across the whole country. And most people acquire their pets from a friend or family. Doesn't matter what kind of person you are, where you live across the country, and what sort of housing you are in. With cats, another common thing is the cat found me. As many of us know, it's really easy for a cat to find you. And in my experience working with pets of people experiencing homelessness, it is no different than my experience in private practice. And even some of the things Susie was talking about leashes being made from belts and other things, like, I will tell you, I worked in a private practice and I've seen telephone cords as leashes. I've seen all kinds of things. So I think it's important for us to, be mindful of the judgment that we would make assumptions. I have not ever seen any evidence of a pet being stolen. I sometimes you hear rumors and stories and things, and same thing happened in private practice. So to me, in my experiences as a private practitioner, as a shelter veterinarian, and then doing outreach work, I feel like actually there's many similarities amongst the pet owners. So I just wanted to make sure I said that, because I think that's a common misunderstanding.
I want to jump in on. Oh,
I mean, in case Susie and Gracie want to weigh in as well, just read the question for everyone, excuse me. Many people wonder how homeless people acquire their pets, since even to adopt it requires some money. Are any of these pets stolen? And I think Dr. Aleisha did a beautiful job with that. But if either of the other panelists want to weigh in.
I want to jump in too, as Dr. Alicia said about the stigma, wealth does not determine a good pet owner. We see, pet owners who are irresponsible all across the board, any income level, and some of the very best pet owners I've met don't have any income. So that really, there's no correlation there, but most of the people that I talk to, I agree, they get it from their friends or family. They know someone who had puppies, and that's how they usually acquire their animals. I don't usually see stolen animals. Same with Dr. Alicia. It's very, I think it must be a very rare occurrence, but most of them will get them because they knew someone who had puppies or someone else who had to give up their animals for a reason or two. That's usually what I see when I talk to people. There's no stolen animals out there that I know of.
Thanks, Susie. Okay, next question. What is the difference between a service animal and an emotional support animal? This is a question that I actually get a lot in my work, so I will take a stab at that. Basically, the only thing they have in common is that there are federal laws that pertain to the possession of either of those animals by a person with a disability. That's what they have in common. Otherwise, they're very different. Service animals rules are governed by the Americans with Disabilities Act. Service animals are basically only dogs. You can also use miniature horses, but we don't know of any instances of that in Hawaii. Service animals are trained to perform specific tasks for the disabled person, and service animals are allowed to go anywhere where that person would be allowed to go. They are not considered pets under the law. So most laws that pertain to pets don't apply to service animals. Emotional support animals, on the other hand, are governed by the Fair Housing Act. So their access is considered a reasonable accommodation for a disabled person in housing. Those animals do not have to have any special training, and they don't need to be allowed access to other public spaces, so like grocery stores and that sort of thing. It's just a housing accommodation. So I actually have a very good booklet if anyone wants detailed answer to this question, and please email me. I'm happy to share it with you. My email is skendrick@hawaiianhumane.org, and I will open it up to the other panelists if anybody has anything to add.
One thing that I would add is for an emotional support animal, sometimes people come to veterinarians asking to kind of qualify that animal as an emotional support animal. That would come from the human service provider. And I will say that very commonly having that letter can help people access the services they need with the pet not being the barrier, whether that's things like bus passes or other things, ability to take that animal more places, even though technically ABA and service is really the kind of the one really protected category. I have found that to be very helpful, and something the Street Dog Coalition does do is while vets are not required, they do help people avoid some harassment about taking their pets places. And so that is something that we do. If clients have a letter, we will help get them a vest so that just helps them function with people, not harassing them about their pet.
Thank you. Next question is, what would you say to a long-term homeless person that states that they won't go into housing unless their animals can go too? I gather the person has 2 pit bulls.
And I would say, okay, not a problem. Right? No problem. You know, and again, there's that stigmatism about pit bulls, but I've met some of the most friendliest pit bulls. I would just have to find a pet-friendly landlord that will take them. I wouldn't ask them to separate. I would keep them together. Yeah, and just find a landlord that will house them, because it can be done. It has been done.
Thank you, Gracie. Not related to pet rental issue, but Lana Raposa has a question. Last year, I saved 10 pups from a homeless man that was going to get coffee creamery to feed them. He had them covered in plastic in a plastic hot container, which nearly killed them. He was going around trying to sell the puppies to save them. I bought them. I have 6 now. 4 went to other homes. A couple of weeks ago, I came across him again, and he's got another 10 puppies. What can be done to stop this cycle of homeless people getting more animals they can't care for? I would love to have a magic answer to that question. This is a source of a lot of frustration for us as well. And one of the reasons that we put so much emphasis and resources into offering spay-neuter for the community. But I'm going to turn this over to the panelists before I get all kinds of emotional myself.
I will take a stab at answering this. So what you want to do is probably report him to our field services team, because if the puppies are, you know, he nearly killed them, you said, if they were in distress, our field services team can talk to him, particularly if you know what location he tends to hang around. They can talk to him. The first thing they'll do, of course, is educate him. They'll talk to him, let him know what he's doing. You know, sometimes they listen, sometimes they don't. And I want to just point out that this isn't an issue that is reserved to just people who are homeless. We see issues like this where puppies are being mistreated and animals mistreated in every way, shape, or form. And so we want to make sure that people are following the law. And if we can, we want to talk to him. What we would do is try to convince him to, which I'm guessing he has mom dog somewhere out there, convince him to spay and neuter her so this cycle will stop. You know, if the animals are really in distress and they're dying, there's a good chance that we will probably take them into our care so we can rehabilitate them and send them out to adoption. But that would be really the best thing. You can call. Our line is always open at 356-2250. Call our field services team so they can begin that. And if anything, we will have a report on him, and we can continue to keep a record on this situation and continue to do wellness checks, because that's something that's really important to do, to make sure that he knows that, you know, we're there, we're keeping an eye on it, and to see if we can fix the problem and work with that pet owner.
I want to add something here that, I mean, that, you know, a situation like that we wish we didn't see. And I'm not a human health provider at all, right? I'm a veterinarian. But there's many of these cases that are not just the pets. And while enforcement can play a role in trying to intervene and help an individual at one time, like, we know when we have mental health issues in particular, like conditions such as animal hoarding or hoarding of objects, we know that enforcement in animal hoarding is only helpful to help the animals at the time. It has 100% recidivism. It is ineffective at preventing the situation in the future. And so I think the key is also not looking at that as a pet issue. Oftentimes it's a human mental health issue, and it's us working together. So the most successful animal hoarding interventions, which we still haven't figured out, but it's when human health providers and enforcement and animal welfare community and veterinarians all work together, that we find the most effect. And one thing that I will say about spay neuter, because I think as somebody who's been a veterinarian for a long time and worked in animal welfare organizations for a long time, sometimes we act like we know what is best for people's pets. And I have done this myself. I have approached it from, you need to spay and neuter your pet. And I will tell you that that is a not very effective way to get compliance. people have trust issues for many good reasons. And so I have found through working at Punavai and other communities is building trust will often get you there, but you need to build trust. Why would somebody who has very little in this world besides this dog or cat that they love dearly give that pet to me? They have no idea if I'm going to come back with them. It's surgery, it's scary. People are traumatized at the thought of taking their dog or cat away, and you need to build that trust. And I've seen that over and over again, that over time, just letting people know we offer it and that it's something that we're here for, but also respecting that they're adults and that they know they, in partnership with their pet, know what's best for them and their pets. And then there's times where harmful things happen, and that really needs human mental health professionals. It's not an animal per se problem. So I think we want enforcement to fix all of these problems, and I think enforcement is a tiny sliver of the way to fix these situations.
Thank you for that, everybody. Sorry, I'm having trouble responding to people in the Q&A, so I just wanted, someone asked what organization Gracie works for. It's Partners in Care. And my email again is skendrick, skendrick at hawaiianhumane.org. And if I can ask the organizers of the conference if there's a way to email out follow-up information as well. So that'll be in writing for folks. My apologies if this was already addressed. Are there any opportunities to shelter pets for survivors of domestic violence who are seeking DV shelter?
For the LEP side, I can house the surviving victim and the pets together. But as for temporary holding, LEP doesn't have any. Susie, do you folks accommodate?
We don't at the moment, but I do know Women in Need is housing domestic violence, victims of the domestic violence with their pets as well. And I believe Domestic Violence Action Center is also, DVAC is also is pet friendly, and they're housing people with their pets. So you may want to reach out that way to see if they can be housed together. But yeah, the situation would likely be housing together rather than separate.
Those are all of the questions I have in the Q&A so far. So if anybody's got more questions they want to ask, please put them in there. I actually had a couple, so I will go ahead and ask mine, barring anyone else's contributions. I was thinking about the pet insurance thing that you brought up, Gracie. Are landlords looking for insurance for protecting property damage? Usually when we think of pet insurance, we think of pet health insurance, but I'm guessing that's not what they're talking about.
Of a liability situation. So for example, a lot of the landlords that we work with already have insurance in place. Some of their insurances can cover tenant pets, and some of them don't. And so a lot of the landlords will ask tenants to get pet insurance just in case something happens between the client's pets and another pet on property or an individual, and things like that. And they're easy to get. They're fairly reasonably priced. But in all my housing placements, and I'm talking about over the past 6+ years when I was with Aisha's previously, I've only had one landlord ask, and just one. And I believe they only had to pay $5. Other than that, our landlords are pretty cool. They already have insurance in place. Landlords just, majority of my landlords just want to make sure that the pet has, or the animal has, a clean bill of health. And they just ask for a copy of the vet assessment. But other than that, my whole entire, only one time, and that was it.
Yeah, and Ronnie had a similar question to mine, but thanks for clearing that up, Gracie. It's actually liability that the landlords are worried about, not the health of the pet or any of those other sorts of insurance we might think about. Luana, I can put the field services phone number in the chat for you. Another question that I had, Gracie, from this was actually from your earlier presentation that you were giving at the conference. You talked about the work that your program does with landowners, with landlords, to give them sort of house rules and, you know, really top level, like 5 bullet points, quick tips about, so that the tenants know how to be a good neighbor, sort of what's expected of them. Susie mentioned that we have a whole pedicate program, but that's a pretty good commitment of time. You know, you have to sit and, you know, watch the presentation and have a conversation. Do you think any sort of pet specific simple handout would be of benefit to your program?
Actually, that'd be great. I was just about to ask you, is there a way you can send me a PowerPoint? Because I'd be happy to, because I bring my laptop with me. I'll be happy to sit down with them and show them that PowerPoint or go over that brochure with them so that there is a clear understanding. And then also I could give a copy of that to the landlord so that they know that the tenant has been educated about pet etiquette and things like that. So yeah, that'd be great.
Good, Suzy
We will
Tam?
send it over to you. No, I'm just going to tell Gracie we will send the pedicate presentation right over to you.
We just have a few minutes left. Do any of the panelists have questions for each other?
No, but I see a question in
There's one
the
more question in
chat.
the chat.
Oh,
There's a
okay.
couple questions in the chat. Sorry, I just posted it, reposted it for you guys to see.
Do we know how many people are homeless just because they cannot find housing that allows pets?
I do not. I just hear a lot of from the owners directly or from other outreach workers that they don't want to go into housing because they have pets. That's so, but I don't know an actual number. Does anyone else have an idea?
LAP also doesn't have the actual numbers, but I did go and do some outreach a couple of days ago, and that was in the Crane Park and Mo'iliili area. And I think at the Crane Park, I ran it out of the 6 possible clientele I encountered. All 6 had pets, and they had numerous pets. So already right there, it tells you that one little demographic area, right? So I'm sure that it is a larger number, but I don't have the actual count. But that would be a good idea to maybe I'll ask outreach and see if they're keeping.
Susie, I think this is for you. You said you have outreach. Does that mean you go where the client is? Or maybe it's for Gracie. I'm not sure.
Maybe it's for all of us.
all of
We are trying, so we are limited. There's 2.5 of us outreach workers, and we do a lot of work over at our campus, but we have gone out into a camp over in Makaha, and we did one recently over at Iwilei. So we're starting to try to get to know these owners. Like Dr. Aleisha said, there's a lot of mistrust. You know, people think of the Hawaiian Humane Society as people who take away animals. You know, I mean, I hate to say, but that's the number one question I get asked when we show up somewhere is, are you here to take their pets? And, you know, I always respond, no, that's not my job. My job is to work with people and to make sure that their pets are being cared for. But we really need to build that relationship. And I think the best way for us to be able to do that is work with either human services agencies, because they know their clients the best, or other animal rescue groups who go out and also deal with these populations, which we have. You know, we've worked with Paws of Hawaii, who go out into those camps, as well as a social worker who, Aloha Animal Outreach, who does a lot of work out there. So, but our main issue is starting to build that relationship. So we're starting to do more outreach, starting to go out to more where the client is and trying to take some of that burden off of our field services team. So they can concentrate on doing enforcement while we can concentrate on helping. So, yeah.
For veterinary services, we are with the Street Dog Coalition. We have pretty much provided pre-COVID once a month clinics at Punawai Rest Stop. Our limitation, like all of our services have been volunteer, so we haven't had any funding to pay a veterinarian or a technician to do the work. And all of our funding has come through this Colorado-based nonprofit. So some sources of local funding might help us expand that opportunity. But Punavai Rest Stop is where we have been looking now at the ability of doing an event where you have 20 pet owners kind of in a line waiting to get services is maybe not the best thing in the current state, and needing social distancing and those kind of things. So we are both looking at restarting clinics there, but then also something I'm working on is looking at, like, are there ways to connect more individually? So it's more work on our part, but connect more individually to get those vet exams for clients who are waiting to get into housing, and that helps them get there. So that's kind of, I feel like the Street Dog Coalition is in a little bit of a shifting sort of what is our most effective way to meet the needs for people out there. But Punavai Rest Stop is where we've been based. It's been a perfect environment. They're very pet friendly. People can access it, get there by the bus. So that's been a easily accessible place, and the word has gotten out. People know.
All right, I think this will have to be our last question given the time. What is your most successful intervention with aggressive dogs?
Well, I think nothing like having 4 minutes to talk about the term aggressive dogs. But that term is, I think, seems very easily and intuitive, but actually from a diagnosis, that's a complicated term. What we know is that most of the time that behavioral interactions that could lead to a person or an animal being injured is often derived by fear. And so if we can find ways for animals to not be fearful, that is our most successful intervention. There are things like medication and things that can help if animals have anxiety, but I think a really important thing is to be mindful of what's the root of aggression. Is it protecting somebody's space? That's what dogs are supposed to do, and when we're thinking about dogs. So don't go into people's space, right? And different dogs have different levels of territorial aggression, but that's definitely why you need to be mindful of a dog does not define their space as a yard or a fence. Like, they define their space wherever they determine their space to be. And then also being mindful that most aggression is fear-based or anxiety-based. And oftentimes if we give animals space, then there's not an issue. So if we can, in housing, for example, avoid situations where dogs feel like they have no alternative other than to be proactive with their defense, then that can really help a lot too. So sometimes it's traffic routing, sometimes it's where that person unit is, so that we can get them to a place where they're not going to feel cornered by another person, that kind of thing. And sometimes it's training the humans not to approach a dog who's giving you all the signals that say, please don't approach me.
That's actually a really good segue to something that I forgot to mention earlier. We will be hosting a training with a national animal behavior consultant for anyone who works in the Human Services Agency that will teach you a little bit about dog body language, cat body language, approach, and things like that. And it'll be virtual. I'll work with Partners in Care to send out the invitation to that, but that will be available to anyone who is working with these pet owners. Just to be able to read a dog, I think, is really helpful. I have heard from some human social service providers that they're a little uncomfortable because they're not sure how to tell if a dog is friendly or not, or how to read a dog properly. So I'm hoping that this will help a little bit and able to kind of look at a dog or even a cat to be able to see the signals and to read those signals before any approach is given, because we don't want to just go in and like pet a dog's face. That's not something we like to do because that's really scary. So if you are interested to look out for the email, I would love to have whoever wants to participate in that session when we offer it.
And pending any training, I will tell you right now, my very expensive veterinary degree lesson for anybody who's going out in the community and is worried about dogs is an abundance of tasty treats. And that can be like hot dogs you get at Costco, like totally fine. Like, dogs speak the language of food. So easy, quick.
Fear-Free Shelter Training calls it the power of cookies, and it is not to be underestimated. I just wanted to thank everybody. I'll turn this back over to Danny. What a wonderful discussion. Thank you to our panelists who were amazing. Thank you for your questions. Hope to keep this dialogue going and have all of us pulling together to keep more families together. Really appreciate the opportunity to talk to you all today.
Yeah, thank you. Thank you guys for a great discussion. It was awesome. Just for the participants, you can go back to the conference webpage for the closing plenaries. And also just a reminder that this session is recorded, so it'll be available at a later date. I just want to thank you all for joining us, and thank you to the panelists for sharing such useful information. I hope this was beneficial for everybody. So thank you.